Namaste. I'm Alakananda Ma, Ayurvedic doctor and principal of Alandi Ayurveda Gurukula, an Ayurveda school in Boulder, Colorado. Welcome to my channel. Today, I want to talk about loss of taste and smell. In Western medicine, loss of smell is called anosmia, and a blunted or diminished sense of smell is hyposmia. And in Ayurveda, we call loss of smell grananasha, and we note that it is often accompanied by arasagnyata, or loss of taste. These sense organ impairments are listed in the 80 diseases of Vata in the Ayurvedic texts. So basically, you can lose your sense of smell because there's something going on with your nasal mucosa or sinuses, or you can lose your sense of smell due to a neurological issue. In the latter case, there's nothing wrong with your nose. It's your brain not reading the signal. So thinking about your nose first, we're all familiar with losing our sense of smell when we have a cold and stuffy nose. And we know that this affects our taste as well, because of a lot of what we associate with the taste of food is actually its aroma. We'll often lose our sense of smell with flu as well, and with allergies or sinus infections. And usually, luckily, these episodes are temporary, but we can certainly help our nose to be less stuffed up. We can use a Neti Pot. Here are a couple of my favorite models of Neti Pot that I use. We can use a Neti Pot to irrigate the nose with a lukewarm saline, and that will clear a stuffy nose, help the sinuses drain, and doing this irrigation with the Neti Pot washes out bacteria, pollen, molds, and other allergens that are stuck to the lining of our nostrils, of our nose. It's best to use lukewarm distilled water and pure Himalayan salt or natural mineral salt, and use about half a teaspoon to a cup of water. The water should feel comfortable and soothing. If it's irritating, it's either not salty enough or it's too salty. And after irrigating the nose, it's important to dry it. So we like to do anulom vilom, like pretty forceful. Like that, to dry, do a bunch of that to dry the nose. And we also do forward bends to drain the water out of the nose. As well as the neti, you can use a nasya oil. There's a nice one sold by Banyan Botanicals. So wait till your nose has dried from doing neti, and then instill 5 drops of nasya oil in each nostril. And it's best to do your nasya in fish pose with your head tilted backwards. Unfortunately, if you have a severe sinus infection or long-term allergies, loss of smell and taste can become a chronic condition. There could also be perverted taste where everything you eat tastes horrible. So if your loss of smell doesn't respond to neti and a generic nasya, it is best to see an Ayurvedic practitioner, get a special nasya and some custom herbal remedies to nip the condition in the bud before it becomes chronic. So anosmia has been in the news a lot of late, since it's a signature symptom of COVID. But the type of loss of smell that COVID patients experience is completely different from what you get with a cold and stuffy nose. SARS-CoV-2 is what we call a neurotropic virus, meaning that it likes to attack the nervous system. And after the virus attaches to the nasal mucosa, it doesn't have far to travel to the base of the brain, where the olfactory bulb is located, the place where your body reads the smell signals. With COVID, loss of smell and taste is a neurological problem. As such, it's much harder to tackle. Some people get a more transitory loss of smell and taste, while for others, it can be persistent, and it seems to reflect long-term damage to the olfactory bulb. We often take our sense of smell for granted, but if you can't smell smoke when you need to, your life may be in danger. If you can't smell or taste your food, you may lose your appetite and suffer unwanted weight loss. And life is full of so many aromas, from roses to fallen leaves, that are evocative and pleasurable, as well as stinks that signal something we need to stay away from or remove from our environment. So smell is a really basic and important part of our life. For intractable loss of taste, here's your friend, the pomegranate. Ayurvedic texts recommend doing a mouthwash with pomegranate juice with a pinch of rock salt and a teaspoon of honey, and you just hold it in your mouth for as long as you possibly can. This might be worth trying because it is said to cure even incurable loss of taste. For loss of smell, we're thinking about two factors. First, we want to get the viruses out of the olfactory system, out of your smell apparatus. Long COVID with persistent symptoms is very probably due to the virus persisting in the body. Secondly, we want to improve the function of the olfactory system by improving dopamine levels. Nasya is the most direct route to accomplish both these ends. So we've created a special nasya for people with COVID-related loss of smell and taste. In addition, we give herbs to take orally that are nervine and antiviral. Don't delay. If you've lost your sense of taste and smell, seek Ayurvedic treatment right away. The longer it goes untreated, the worse the potential damage. As the brain has great power to heal itself, we also suggest doing sensory rehab by smelling a set of essential oils every day while telling yourself, this is rose, this is orange, this is pine, etc. Recall the smell in your memory as you do this. And as Grananasha and Rasagnyata are defined as Vata conditions, take a Vata soothing diet. Eat warm, soupy, well-cooked foods like soups, dals, and khichiris. And we have lots of great recipes on our website for that. Make sure you get plenty of essential fatty acids by eating healthy oils like ghee, olive oil, and avocados. If you've lost your appetite due to not being able to taste your food, take a quarter to a half a teaspoon of agni kindler 5 minutes before meals. You can make a batch and keep it in the fridge. But to make a half cup agni kindler, you're going to grate a quarter cup of fresh ginger and a quarter cup of fresh turmeric. If you can't get fresh turmeric, you can make it with just ginger, but usually most of the natural grocery stores, Whole Foods, etc. now are carrying fresh turmeric. Squeeze on the juice of half a lime or lemon and add a half teaspoon of salt. And I'll put that recipe for you in the blurb so you can see it. You can also support your appetite by drinking a tea made from cumin, coriander, and fennel using whole seeds. Add a third of a teaspoon of each to a cup of water. Boil till the seeds sink, strain and drink. And you can make a 3 to 4 cup batch for the day and drink it throughout the day. So neurological loss of smell doesn't only happen in COVID. It can also be part of neurodegenerative diseases like Parkinson's, Alzheimer's disease, as well as multiple sclerosis and ALS. In fact, loss of smell may be the first symptom of Parkinson's years before the characteristic motor symptoms appear. Similarly, in the case of Alzheimer's, loss of smell may be an early warning symptom. Well, if you look up Parkinson's disease on Dr. Google, you will learn that Mukuna Prorians, we call in Sanskrit Kapikachu or Atmagupta, helps endogenous dopamine production. But please don't just order a bag of this herb because you may not know the best way to use it. We don't recommend using herbs as if they were drugs. An Ayurvedic practitioner will create you a custom formula, a special nasya, and an entire regimen to support your best health. A herb isn't Ayurvedic because it comes from India. It's Ayurvedic when used as part of a holistic Ayurvedic regimen and tailored for your constitution. Don't self-treat for a serious condition. Seek expert help. And as noted by Shakespeare, diminished taste is also part of the normal aging process. Last scene of all that ends this strange, eventful history is second childishness and mere oblivion. Sans teeth, sans eyes, sans taste, sans everything. Unfortunately, there is no equivalent of the hearing aid for the sense of taste. Supporting the health of your sense organs by eating colorful fruits and vegetables every day and taking regular exercise and fresh air is the best way to go. The elder years are the Vata time of life. So if you are an elder, follow a Vata soothing diet, eating broths, soups, dals, and khichiris, and oil your body at least once a week with Ashwagandha Bala Tailam. It's a lovely oil, it calms your vata and it's good for your aches and pains, or the oil your practitioner recommends for you. Please care for your vata at every stage of life so you can continue to enjoy the fragrance of life for many years to come. Hope this was helpful. If you enjoyed, thank you. Namaste.